Welcome back to the channel. Today we will learn about bacterias. Bacterial diseases are illnesses caused by harmful bacteria that invade and multiply within the body. Bacteria are single-celled microorganisms that can cause a wide range of diseases in humans, animals, and plants. Some common bacterial diseases include tuberculosis, a bacterial disease that mainly affects the lungs and can spread to other parts of the body. Cholera, a bacterial disease that causes severe diarrhea and dehydration. Lyme disease, a bacterial disease spread by ticks that can cause fever, headache, and a skin rash. Streptococcal infections, bacterial infections that can cause strep throat, skin infections, and other illnesses. Salmonella, a bacterial infection that causes food poisoning and can lead to symptoms such as diarrhea, fever, and abdominal cramps. E. coli, a bacterial infection that can cause diarrhea, vomiting, and abdominal pain. Meningitis, a bacterial infection that causes inflammation of the membranes surrounding the brain and spinal cord, leading to symptoms such as fever, headache, and a stiff neck. Pneumonia, a bacterial infection that affects the lungs and can cause symptoms such as cough, fever, and difficulty breathing. Gonorrhea, a sexually transmitted bacterial infection that can cause symptoms such as painful urination and discharge from the genitals. Tetanus, a bacterial infection that affects the nervous system and can cause muscle stiffness and spasms. Legionnaire's disease, a bacterial infection that causes a severe form of pneumonia, often associated with contaminated water systems. Diphtheria, a bacterial infection that causes a thick coating in the back of the throat, which can lead to difficulty breathing and swallowing. Staph infections, bacterial infections caused by Staphylococcus bacteria, which can cause skin infections, pneumonia, and other illnesses. Treatment for bacterial diseases often involves antibiotics, which are drugs that can kill or slow the growth of bacteria. The first antibacterial medicine is considered to be Salvarsan, also known as Compound 606, which was developed by German scientist Paul Ehrlich in 1910. Salvarsan was used to treat syphilis, a bacterial infection that was widespread at the time. However, the overuse of antibiotics can lead to the development of antibiotic-resistant strains of bacteria, which can be more difficult to treat. Prevention measures such as good hygiene practices and vaccination can also be effective in reducing the risk of bacterial infections.